Ever wondered why weight loss seems like a never-ending battle for some people? Well, the journey to losing weight isn't as straightforward as it seems, with numerous factors contributing to the complexity of the process. Firstly, it's crucial to highlight the role of genetics in weight loss. Our genes significantly influence our body weight, dictating hunger levels, metabolism rate, food cravings, and our body's response to exercise. Some individuals are genetically predisposed to store more fat or have slower metabolic rates, making weight loss more challenging. It's almost like participating in a genetic lottery, where some people are not fortunate enough to draw a winning ticket in the weight loss category. Following genetics, we delve into the impact of lifestyle on weight loss. We are living in an era by fast-paced lives, high-stress environments, and overbooked schedules. These aspects often push individuals towards a sedentary lifestyle, where physical activity is minimal or non-existent. The lack of time for regular exercise becomes a severe impediment in the journey towards weight loss. Moreover, the modern lifestyle also encourages unhealthy eating habits. The convenience of fast food and processed meals, while tempting, often serves as a quick but unhealthy solution for meals. Such foods are typically high in calories, saturated fats, and sugars, but low in essential nutrients. A recipe for weight gain rather than weight loss. Then we have the critical component of diet, the weight loss equation. An ideal diet comprises a balanced intake of fruits, vegetables, lean proteins, and whole grains. However, the challenge lies in navigating the nutritional landscape, riddled with conflicting information about dietary recommendations. This confusion often leads to poor diet choices, further complicating the weight loss journey. And lastly, there's the vital aspect of physical activity. Regular exercise plays a pivotal role in burning calories and building muscle, which in turn helps boost your metabolism. This cycle makes physical activity an integral part of a successful weight loss plan. However, the motivation to keep up with regular exercise can wane, especially when desired results seem elusive. This can make the weight loss journey seem more like an uphill battle. But it's not all doom and gloom. Weight loss, albeit complex, is not impossible. With an understanding of these factors and a tailored approach, it's possible to overcome these challenges. So with all these obstacles, it's no wonder that weight loss can feel like an uphill battle. But what if there was a way to aid the weight loss process? Scene script. Weight loss drugs might be a solution for some, but what are they exactly? To begin to answer this question, we must first define what we mean by weight loss drugs. Essentially, these medicines are specifically engineered to aid individuals on their journey to lose weight. Their design tends to focus on a handful of key functions, including appetite suppression, amplification of fullness sensations, reduction of fat absorption, or a boost in metabolism. To better comprehend how these drugs work, think of them not as a magical solution that will make unwanted weight disappear overnight, but as an aid, or a support system if you prefer, that works best in conjunction with a nutritious diet and regular physical activity. Weight loss drugs offer a variety of mechanisms to help you on your weight loss journey, but they are not a miracle cure. They require effort and commitment on your part. There is a wide range of weight loss drugs in the market, and each of them works differently based on their active ingredients, making them more suitable for certain individuals over others. Some drugs work by making you feel less hungry, or full sooner, which results in you eating less. This is achieved by stimulating certain hormones in your body that control hunger and satiety. Others work by reducing the body's ability to absorb dietary fat. These types of medicines tend to block the enzymes in your digestive system that break down fat, which in turn leads to less fat being absorbed by your body and more being excreted. Then there are those that work by increasing the body's metabolism rate, hence helping you burn more calories. These drugs stimulate your body's metabolic activities, prompting it to burn more energy even while at rest. Interestingly, certain medications designed to manage diabetes have been found to have a side effect of weight loss in some people. These drugs, primarily designed to regulate blood sugar levels, have shown in some cases an unexpected side effect, contributing to weight loss. But take note, these drugs are not to be used for weight loss purposes without the express guidance of a healthcare professional. It's crucial to understand that weight loss drugs are not for everyone. They are typically prescribed for people with health issues related to obesity, such as high blood pressure or diabetes. Additionally, they are suggested for those who haven't been successful in losing weight through diet and exercise alone. One important thing to underline is that weight loss drugs are not designed to be a standalone solution. They work most effectively when combined with lifestyle changes like a balanced diet and regular exercise. Also, it's essential to know that these drugs can cause side effects, and their long-term effects are not fully understood. Therefore, they should only be used under the supervision of a medical doctor. Now that we have a basic understanding of weight loss drugs, let's delve deeper into some specific ones. Firstly, we have orlistat, a popular weight loss drug. This medication is a potent tool in the fight against obesity. Primarily, it operates by hindering your body's ability to absorb fat. Our bodies usually digest food using enzymes, which fractionate fat into smaller molecules that can be absorbed. However, orlistat ingeniously disrupts this process, blocking about 1/3 of the fat from being taken up. This unabsorbed fat, high in calories, is then naturally excreted from our bodies. It's a simple equation. If your body is taking in less fat, it's also taking in fewer calories, which promotes weight loss. But even the most effective medications have their drawbacks, and orlistat is no exception. It can cause certain digestive issues, calling for careful monitoring of one's diet and digestion while on this medication. Additionally, it might also impact the absorption of certain essential vitamins. Hence, it's advisable to take a multivitamin supplement in tandem with orlistat. This is recommended to ensure that your body receives all the necessary nutrients. In conclusion, while orlistat can certainly aid in weight loss, it is not an instant solution. It needs to be used in harmony with a lower caloric diet and regular exercise, and should always be taken under a physician's guidance. It should be used in conjunction with a reduced calorie diet, regular physical activity, and under the supervision of a medical doctor. Next, we have a class of drugs known as glucagon-like peptide-1 receptor agonists. This terminology can seem daunting, but together we'll simplify it. These medications, predominantly used in diabetes management, surprisingly contribute to weight loss. Intrigued about how it functions? They impersonate the role of a hormone situated within your digestive tract, glucagon-like peptide-1. This hormone's primary role involves slowing your digestion process, thereby extending your feeling of fullness. As a result, you are more likely to reduce your food consumption, aiding weight loss. A fascinating aspect of these drugs is their capacity to decrease blood sugar levels, thus frequently prescribed to diabetes patients. Nevertheless, it's critical to remember that these drugs are not a magic solution. They form part of a holistic weight loss strategy that needs to incorporate a well-balanced diet, along with regular physical activity. Similar to orlistat, these drugs are not a wonder remedy and should be utilized responsibly. Lastly, we have a combination of drugs, naltrexone and bupropion. This potent pair acts together to regulate your cravings and hunger. Naltrexone, initially used for treating alcohol and opioid dependence, helps control your food cravings. Meanwhile, bupropion, an antidepressant, works to reduce your appetite. There are, however, precautions and side effects to consider. This drug mix may lead to nausea, constipation, or headaches. In certain rare circumstances, it could heighten the risk of suicidal thoughts. It's not suitable for everyone. Those with high blood pressure or seizure disorders should avoid this path. These drugs are not magic bullets. They are aids to assist you in your weight loss journey. They're most effective when paired with a balanced diet and regular exercise. Remember, these drugs can aid in the weight loss process, but they are not a replacement for a healthy lifestyle. This video is not medical advice and shouldn't be relied upon without discussing its contents with your medical doctor. We've discussed 3 weight loss drugs: orlistat, glucagon-like peptide-1 receptor agonists, and naltrexone bupropion. They can be useful aids in the weight loss procedure. Each works differently to help promote weight loss. Orlistat, for example, reduces fat absorption by stopping fat breakdown in your gut, leading to lower calorie intake. Glucagon-like peptide 1 receptor agonists also aid in weight loss by slowing digestion and curbing appetite. In addition, they can help manage type 2 diabetes. Naltrexone bupropion merges two drugs to influence the brain's reward centers, curbing cravings. It's vital to recognize that these drugs aren't a panacea. They aren't a total solution for obesity or an alternative for a healthy lifestyle. They work best when incorporated into a comprehensive weight loss program involving a balanced diet, consistent physical activity, and lifestyle modifications. These drugs should only be taken under a healthcare provider's vigilant supervision due to potential side effects and variability in effectiveness. They may also react with other medications, making it crucial to consult with your doctor before starting any weight loss medication. Typically, these drugs are recommended for individuals with a body mass index, BMI, of 30 or more, or 27 with a weight-related condition like type 2 diabetes or high blood pressure. They are not intended for those who want to lose a few pounds for non-health-related reasons. Do not consider anything contained in this video as medical advice. It is for informational purposes only. You must consult with a medical doctor before taking any medication or starting any diet.